introduce everybody to our webinar, Exercises to Stop You from Falling. And like I said, we're very lucky to be joined by Trish. So Trish Lynch has worked as a physiotherapist in numerous areas of healthcare. Working in rehabilitation and aged care has led to a passion for falls prevention, with the knowledge that many falls that have caused significant injuries could have been prevented. Trish has worked for the last 6 years as the Southeastern Sydney Local Health District Stepping On Falls Prevention Program Coordinator. Stepping On is an evidence-based falls prevention program for elder people living in the community and covers the most common falls risk factors such as reduced vision. The program includes exercises for leg strength and balance. So thank you so much, Trish, for joining us today. I can see your presentation, which is really great. Can't see your face just yet, so you might have to turn on your webcam there. Perfect. Hi, Trish. Thank you so much for joining us.
Pleasure. Well, thank you very much for having me today. I am very excited to be able to chat to you all about falls prevention and about exercises to help you stop falling. I am here representing the Healthy Ageing team, which is part of the Health Promotion Service of South East Sydney Local Health District. We have a very diverse backgrounds and use our varied skills to support the health of the members of our community. I have a background in physiotherapy, as you've been told, and I have a passion for falls prevention in older people. This is due to having worked for many years in various clinical settings, such as rehabilitation and older persons clinical services. In these roles, I have often seen the result of having a fall has on a person in terms of injury, pain, mobility, independence, and confidence. Sometimes the results are life-changing, and the person may need to move to an aged care facility when they previously lived independently at home before the fall. This loss of independence can be devastating, more so as many falls are preventable. Picture a simple walk along a pathway, a sudden trip on a slight unevenness, a fall, a fractured hip, surgery to replace the hip, months of rehabilitation. You probably know someone who has had this experience. Now, more than ever, with all the recommendations to stay at home, to stay safe, we are finding more people are becoming deconditioned. Their muscles are becoming weaker, and they are more likely to fall over. And unfortunately, we're starting to see more people coming into our hospitals because they've had a fall. So what is a fall? The World Health Organization describes a fall as an event which results in a person coming to rest inadvertently on the ground or at a lower height. Many people describe what they call a trip where they end up on the ground as not, and with no injury, as not a fall. Unfortunately, this is not the case. So why should we care about falling? The facts are that 1 in 3 people over 65 years of age will have a fall. 1 in 2 people over 80 years of age will have a fall. People with reduced vision are 8 times more likely to fall than the general community. And if you have a fall, you are very likely to fall again in the next 12 months. Falls can have serious consequences for older people, their families and carers. Falls can lead to reduced quality of life, disability, reduced physical activity, social isolation, functional decline, and even death. In New South Wales, falls are a major cause of harm to older people, and falls-related injuries impose a substantial burden on the healthcare and aged care systems. The fear of falling can be debilitating as people reduce their activities in the community. This results in social isolation and reduced physical activity. This causes reduced leg strength and balance and an increased chance of falling. It is a vicious cycle of reduced independence and life choices. So, what are the falls risk factors? The research has shown that there's a number of significant risk factors. The first is poor vision. As you know, can cause trip hazards to be missed and causes hesitant, tentative walking, even shuffling. The second is clutter. in your home, which causes trips and slips, particularly if you're hurrying. The third risk factor is weak legs or wobbly legs, which can collapse when walking and standing. The fourth risk factor is poor balance, which causes slipping and tripping. There are more risk factors as well. The fifth risk factor is medications. If you take 4 or more medications, this is known to increase one's likelihood of falling. The next is calcium. If you only need enough calcium to have is vital for good bone health. Insufficient calcium causes brittle bones, which is known as osteoporosis. Even rolling over bed when you have osteoporosis can cause a break. Vitamin D is important for the absorption of calcium into the bone to occur. Vitamin D is acquired by being in direct sunlight, a few minutes each day, depending on the time of year. For example, 5 to 8 minutes in Sydney in summer before 10 and after 3 p.m, and 20 minutes in winter, with no sunscreen and no protective clothing. The next risk factor the next risk factor is having had a previous fall. If you've had one, you're likely to have another one in the next 12 months. Finally, footwear. Poor footwear where the sole of the shoe is worn and slippery increases the chances of slipping. Painful feet can cause poor walking style, such as hobbling, which increases the chances of tripping. So the good news is we can prevent falls. Changes can be simple and effective with a little advice and a few lifestyle adjustments. The results are maintained independence, which is well worth a few minutes of reflection. So what can you do to stop the effects of falling, to reduce the effects? The most effective action is to look at the risk factors and see if they apply to you. And then you can remove the clutter from your home. You can falls-proof your home by removing mats that can cause slips and trips. You can have sufficient lighting to be able to see obstacles. You can use night lights for the walkway between the bedroom and the bathroom for nightly visits. You can have sturdy rails installed in the shower or for stairs. You can check that your shoes are not worn. You can wear glare-reducing glasses and a hat on sunny or glary days. And you can check that your medications are correct. Some people are taking the same medication twice as much as they should because of the different names on the packaging. Carry a medication list so that the doctors will know what medications, both prescription and non-prescription, you are taking, as some medications react adversely with each other and can cause dizziness. Take your medications as directed. To help you know if you've taken your medication on that day, you could use a thing called a Webster pack, which is prepared by your pharmacist. Not taking medications such as those for high blood pressure can cause you to be dizzy and therefore fall. It's also advised that you go to the same pharmacist, as they can assist you with understanding what your medications are for and the possible side effects. Think about reducing your use of sleeping medication, as these can cause drowsiness the next day. You could also check your bone density. You could eat enough calcium. For a person over 65 years of age, it is recommended that they have 1,300 milligrams of calcium each day, or about 4 to 5 servings of calcium. Check that your vitamin D level is with a blood test. Calcium requires vitamin D in your blood to assist with its absorption into the bones. It is recommended you have a falls plan. So what would you do if you fell and couldn't get up? Some people wear personal alarms or have a phone on a low table so they can reach it from the floor, or have an arrangement with family, neighbours or friends to check that they are up safely each morning. Think about your strategy. It is also suggested you wear light-coloured clothing on dull days so people can see you and not accidentally trip you or bump into you or even hit you with their vehicle when you're crossing the road. Unfortunately, older people are overrepresented in our statistics for pedestrian injuries, so there's not a good thing. But the single most effective intervention to reduce your risk of falls is exercises to improve your leg strength and balance, which I will detail more later. So one of the things we should talk about is what is the recommended physical activities for people in your age group. So for people over 60 years old, the Australian government guidelines are that you do at least 30 minutes a day for 5 days a week, which equals 150 minutes per week of physical activity. It is recommended that this activity be moderate. It is also recommended that you do at least 2 hours of balance exercises a week. So the 30 minutes a day of physical activity can be scattered through the day, such as 3 periods of 10 minutes each day, or 1 period of 30 minutes. Moderate exercise is described when you can speak whilst exercising, but you can't sing. Balance exercises can be sprinkled through your day and included in your daily routine. So physical activity is most likely to continue if you enjoy what you're doing. Some examples are gardening, walking, Tai Chi, formal exercise classes, and swimming. But specific exercises are for different needs. And this is true for falls prevention. Specific exercises are done to reduce one's risk of falling. These exercises can form part of this physical activity goal for each week. So the types of exercises to reduce falling fall in under the category of balance and leg strength. And these exercises that I'm going to describe to you are recommended and tested and evidence-based and unlikely to cause you damage. The evidence shows that walking alone, however, does not improve balance. The evidence-based exercises that help to reduce your falls risk are straightforward, require minimal equipment, and if completed regularly, which is at least 3 times a week, will increase your leg strength. Balance exercises need to be done every day. A word of warning, if you're not sure about if you should be doing exercises, ask your family doctor. And age is not a reason not to do these exercises. The oldest people who have attended the Stepping On program, which I coordinate, were 104 years old in our area. You are also never too young to start doing balance exercises, as balance starts declining when you are 30, unless you do something to challenge it. The old saying is, use it or lose it, which is very true with regard to balance. The first step when you're doing exercises is to find a safe place, remove the clutter and trip hazards, such as stools, items on the floor, unsecure mats, and your pets. Find a secure support, such as a kitchen bench, a sturdy table, and a sturdy chair. We are all different, and the exercises don't need to be completed at a certain time. Exercises can be sprinkled through the day, or completed in the morning, or the afternoon. It depends on what works for you. It is recommended that you do at least 5 repetitions of each leg exercise on any occasion, however. Find a sturdy chair for the seated exercises, preferably with arms if you have one. If you have a new pain when doing the exercises, talk to your GP or your physio. Some people will need to have exercises modified. Exercises can be incorporated into your daily activities, as I've said. For example, you could do your balanced exercises when waiting for the kettle to boil. You could stand up from your breakfast table 3 times rather than once when you're finished. You could do the seated exercises while you're watching the television. You could do the standing exercises in the advertisement break. So the first exercise we're going to talk about today is called the tandem stand. This is an exercise to improve your balance. What you need to do is to stand up tall, hang on to a solid support such as the kitchen bench, have your feet shoulder width apart. Place one foot straight in front of the other so that the front foot heel is touching the back foot toe. The weight should be placed evenly on each foot. Remain in this position for 5 seconds. Place your front foot back to the starting position. Repeat it 5 times. Repeat having the opposite foot in front. Hold it for 5 seconds and repeat 5 times. Progress gradually by reducing your handhold until your fingers are just hovering over the support. My colleague is now going to demonstrate this exercise. And what you can see is they have the feet apart, then the front foot is put in front, it's held for 5 seconds with the hands on the supportive surface, and then the foot is placed back to the beginning position. The next exercise, which I call the sit to stand exercise or the independence exercise, is really important because if you can sit to stand by yourself, you can get off the chair or off a toilet. You can stay at home if you can do this. once you can't stand up by yourself out of a chair, you often end up having to go to an aged care facility. This exercise improves your balance and works many muscles in your trunk and your legs. To start with, select a sturdy chair. Place the chair with the back against the wall to stop it slipping from under you. Use a chair with arms if you have one, so that you can push up with your hands to assist the legs. Otherwise, you can push off the chair pad. As your leg strength improves, try not to use your hands to help. Move forward on the chair so that you are safely near the edge of the chair. Place your feet flat on the ground, shoulder width apart. Keeping your whole feet on the ground, bend forward at the hips so that your nose is over your toes. Slowly stand up until you are standing tall. Gently walk backwards until you feel the chair behind your legs. Slowly sit down, putting your bottom out and bending at your hips. Don't plop down into the chair, be in control. Repeat this 4 times. To progress, you can go slower. You can increase the repetitions to 4 sets of 5, and you can not use your hands to assist standing up. But remember to breathe. My colleague will now demonstrate this exercise. So bending forward at the hips, feet and shoulder width apart, slowly standing up until you are standing tall. Stand there for a moment, step back until you feel the back of your calves on the front of the chair. Bending at the hips and putting your bottom out, you slowly lower your bottom onto the seat pad in control. The next exercise is called the toe raise. This exercise strengthens the front shin muscle. These muscles allow your feet, when you are walking, to lift up over obstacles, such as cracks in the pavement, and not to shuffle when we walk. Stand up tall with your hands on a sturdy chair back, sturdy table, or the kitchen bench. Keeping your back straight, slowly lift your toes off the ground and hold this position for 5 seconds. Then lower your toes to the floor. Repeat 4 times. Don't bend your trunk forward or backwards. To progress, hold your toes off the ground for longer, gradually building up to 20 seconds, or work up to 5 sets of 5 repetitions. Or remove your hands off the support, but remember, please, to breathe normally. My colleague will now demonstrate this exercise. You can see the feet, my colleague is standing up tall and the toes are off the ground. Ooh, sorry. The next exercise is called the heel raise. This exercise builds up the calf muscles, and these muscles help you to walk up stairs and walk up slopes and climb gutters. So start with your hands on a support such as the kitchen bench or a sturdy table. Stand up tall with the feet on the ground, shoulder width apart. Gently lift up your heels off the ground and hold for 5 seconds. Don't bend forward or backwards. Keep standing up tall with your bottom tucked in. Lower to the ground and repeat 4 times. To progress, increase the repetitions to 5 sets of 5. Increase the holds till you hold standing up with your heels off the ground for 20 seconds, or use an ankle weight. Remember to breathe. My colleague will now demonstrate this exercise. Sorry. Yeah. Standing shoulder width apart, coming straight up with your back straight, hands on the supportive structure, holding those heels up off the ground for 5 seconds and slowly lowering back down so that you're in control. The next exercise is called the front knee straightening exercise. This exercise improves the strength of your front knee muscle, which is called the quadriceps muscle. This muscle helps to stop your legs from collapsing when you are walking. So sit on a sturdy chair with your back supported. Keep your thigh on the chair. Slowly lift your right foot off the ground until your leg is straight. Hold this position for 5 seconds and slowly lower it back to the ground and repeat this 4 times. Then do the same with the left leg. Do not lift both legs at the same time, as this might strain your back. To progress, you can work up to 5 sets of 5. You can hold the legs straight for longer, working up to 20 seconds, or you could use an ankle weight. But remember to breathe normally. My colleague will now demonstrate this exercise. Sitting on the chair with the back supported, lifting up your leg so that it is straight and holding it there for the 5 seconds. And then when you're ready, slowly lower it back down and repeat. The next exercise is called the hip sideways lifting exercise. This increases the strength of the muscles on the side of your hip. These muscles help you to step sideways to avoid obstacles, such as a trolley or a pram coming towards you, or a trip hazard on the footpath. Stand with your hands on a supportive surface, such as a sturdy chair, sturdy table, or kitchen bench. Stand up tall and leading with your heel, lift your right leg straight out to the side without your foot touching the ground. The feet should be parallel and lifted off the ground. Many people make an error by turning their foot outward so their toe is pointing away from them. This will be using the wrong muscle. You hold this for 5 seconds, you repeat it 4 times, and then you do the same with the left leg. It is important that the trunk remains upright and does not lean in the opposite direction or twist. To progress, do 5 sets of 5 on each leg. Hold for longer and gradually work up to 20 seconds. Use an ankle weight and remember to breathe. My colleague will now demonstrate this exercise. We're going to do it from the front and from the side just to show the difference. Sorry. Standing up tall, keeping your feet parallel, leading with your heel, you take your foot out to the side, you hold it for 5 seconds and slowly bring it back in. Or from the side, the same thing, hanging onto a sturdy support. You take your foot out to the side without leaning. You don't have to take your foot very far, and then slowly bringing it back in control. And of course, remembering to breathe. To summarize what I've been saying about progression and such, the first thing is to start with 5 exercises on each leg and hold the position for 5 seconds. If this is too much for you, you can hold the position for 3 seconds and do 3 repetitions on each leg. Start gently, because unfortunately you may not feel the pain of starting new exercises for up to 2 days, and you may not know that you've done too much. Make sure that you progress, and you can progress slowly by increasing the number of repetitions to 5 sets of 5 gradually. Do not do this quickly. It may take you months to get to 5 sets of 5. It may not. You can also progress by holding the position for 20 seconds, but you don't go from 5 to 20. Of course, you gradually build up 5, 10, 15, whatever. But you just do it according to how comfortable you feel and your pain levels. You can add an ankle weight to increase the resistance or increase the strength you're getting. Remember to rest between your exercises. Remember to see your GP if you have any increased pain or questions about your safety to do exercises. For your safety, have someone nearby when you first start exercising, or have your phone nearby. Never exercise when you're feeling unwell or dizzy. And if you've got any questions, as I said before, please see your GP or your physio. And remember to rest between your exercises so that you have recovered and that you're not overdoing it and making yourself likely to fall over. Okay, so we've now talked about the need to do exercises. We've told you why, because we don't want you to fall over. We want you to stay independent. But to start can be difficult to know how to do them safely, to know how to do them correctly, etc. So the Health Promotion Service can support you to start exercising. And there are a number of free government-funded programs aimed at seniors to support them to have healthy, active, independent lifestyles. The first one is a program that I coordinate called Stepping On. It's free and it's evidence-based, and it's about falls prevention for people over 65 years. The program occurs in various venues across New South Wales. The Stepping On program and resources are available in a number of different languages. Weekly discussions on the various falls risk factors are led by an expert in the area, such as a pharmacist when we're talking about medications, and are interactive so that the participants can ask questions and share their experiences. There's a short tea break where we can all have a bit of a chat. And following this, the exercises are conducted to improve leg strength and balance. and they're demonstrated and they're practiced in the session. And if necessary, the exercises are modified to meet the individual's needs and abilities, such as if you may have an arthritic knee, you might need to do one of the exercises a bit differently. The exercises are upgraded as indicated over the period of time. Participants receive resources to support their learning about the topics and exercise journals and exercise descriptions. To meet the current health regulations, however, we are not providing the program face-to-face, and we will be providing the program as an online version very shortly. If you've got any questions or you want to register, my number is 1-800-823-002, which you can see on the screen in front of you. There's another program that's out there as well that's also free, and it is also about independence, but it's just about general active ageing and healthy ageing. It's free, and it's a community-based program for seniors as well. It is coordinated by trained health professionals who run this program for 10 weeks, 2 hours per session, 1 session a week. The Active and Healthy Life for Life program gives you the skills and knowledge to improve your health and well-being. It helps you stay active and independent. The program teaches you how to eat healthy and safe ways to be physically active to improve physical function and prevent falls. Resources are provided to support this learning and practice of the exercises. The face-to-face program is currently suspended as well, and an online version will be available very shortly. Topics include things like healthy plate and serving sizes, goal setting, sugar, fat, salt, label reading, calcium and vitamin D, fibre, and incontinence. Circus-style exercises are conducted to build up arm and leg strength. So if you've got any questions, you can give me a call on the same number, 1-800-823-002, and you can also register that way at the moment as well. Finally, this again is a free program that's funded by the Ministry of Health, and it's called the Get Healthy service. And it's for people over 16 years of age. And the service offers you your own health coach, which is either a dietitian or an exercise expert. And it provides at least 10 telephone sessions over a 6-month period. Information book is also supplied and a coaching journal. One of the features of this program is that the goals are individualised, and they are not all just about losing weight, though this could be the goal. Other goals could be about managing your diabetes, your high cholesterol, your high blood pressure, etc. These are specialised programs for various community members, such as seniors. And the sessions are by phone, so can be easily fitted into your schedule and your activities. And if you need, an interpreter can be organised to assist you with this coaching. To register or to ask questions, the telephone number is on the screen, and it's 1300-806-258. Next is a resource that's called Staying Active and On Your Feet. This resource has a number of interesting pieces of information that I've talked about today, as well as a bit more information. It is free for you from the government and can be ordered from the Active and Healthy website, which is on the screen at the moment, or you can ring 1300-655-957. It also has some very useful contacts in the back, such as for My Aged Care, Transport New South Wales, the Home Care Service, the Get Healthy service, and a number of other helpful telephone numbers. So if you want that book, just give them a call on 1300-655-957. And as I say, it's free to you, or you can download it, or have it mailed to you, your choice. Finally, I'd like to share this slide with you. This is a thought I'd like to leave you with. And as you can read, leaves are supposed to fall, people aren't. Finally, I'm looking forward to hearing some questions from you all. And I would like to thank you for this opportunity. I'm very passionate, as you know, about falls prevention and anything I can do to stop. And you, another person coming in one of our facilities, because they've had a preventable fall, I'd love to stop them. My email address is on the screen right now. I know it's a mouthful, but that is South East Sydney Local Health District, SES-LHD-stepping on, one word, @health.nsw.gov.au. And my phone number is 1-800-823-002. Happy to have any questions or anybody to register for our programs. Thank you.
Thanks so much, Trish. That was extremely informative, and I think all of us learned a lot. So thank you so much for that. Just a reminder for everybody that if you do have any questions, you can pop them in. And as I said, there should be a question mark icon inside a speech bubble. And if you click on that, you can pop in your question in the white rectangle and select send. As I said before, please try to keep your questions quite general in nature, and there's no such thing as a silly question, and only Trish and I will be able to see those. Before I do go on to the questions, however, I will quickly go over the Macular Disease Foundation Australia's pillars. We have a goal of trying to reduce the incidence and impact of macular disease. So our first pillar, prevention and early detection. We provide accurate, current and ongoing information to try and increase the awareness of macular diseases nationwide. Just last year, we reached over 7,000 people through our education sessions. Support and services. So we provide support for the entire macular community, and we also facilitate access to other support services. I'll talk a little bit about this next. Voice of the macular disease community. So it is our privilege to advocate in the best interest of the macular community, whether it be designing policies for state and federal governments or making sure that medical benefits are not cut. And finally, research and data. So 100% of funds donated to our research go straight into our research grants program. And since 2011, we have given a massive $4.1 million to 21 different research projects. Now, this is how we can help you. So on the screen there, you'll be able to see our toll-free national helpline. That's 1-800-111-709. That's not just a number you call when you're having IT issues on your webinars. That helpline number can give you a lot of information. So if you have any questions about age-related macular degeneration or perhaps diabetic eye disease, we can provide you that information. Perhaps you have questions about My Age Care or NDIS. Again, we can provide you that information. If you would like to take a look at our resources, then you can go onto our website. That is www.mdfoundation.com.au, and all of our resources are there and they're all free as well. So all of it is available there. Now, we do have quite a few questions coming through. So Trish, I might get you to come back and we'll take a look at those questions. Okay.
Hey, how you going?
Good.
Let's go.
Okay, so quite a few questions. Let's go all the way to the top. So first one, this is a little bit specific. I had an acoustic neuroma removed 15 years ago, and my left side has total deafness. I have very poor balance. Any particular suggestions?
Well, thank you for this question. I'm very excited about this question because this comes up a lot with our various groups. A lot of people have hearing issues that they feel means that their balance has become poor, but in fact, balance is composed of three different aspects. One is our vision, one is our inner ear, and the third is our leg strength. So the exercises, particularly the first one I showed you today, the tandem stand, can be done to improve your balance. Unless you've got a muscle problem with your legs, such as a spinal cord injury, you should be able to slowly improve your balance by doing that exercise particularly, and the sit to stand exercise also improves with balance. So thanks again for that question.
Okay, moving on to the next one. I'm sitting, so this is, I think, quite relevant to what is happening at the moment. During isolation, I have been sitting a lot more. What are the exercises you would recommend for me?
Well, the exercises I showed you today will help with your leg strength and your balance. And I think that they're a good place to start, because if I give you 1,000 exercises, I'm joking, you won't do them. So I've given you just 6 exercises today, and I would think that they're a great place to start. If, however, you wanted to build on those and do some arm exercises and such, I would strongly suggest you talk to your GP about perhaps seeing your local physio for some exercise specifically for your needs. Just walking, even if it's to the mailbox and back 10 times dotted throughout the day, is a great exercise as well. I've talked to different people over this period of time, and they're actually walking around their backyard just to get enough exercise. I told you today that you need 150 minutes of exercise per week, so you can sprinkle that through your day and without even leaving your property if you don't want to.
So even in isolation, all of these exercises can still be done.
Absolutely. Yeah.
So someone has asked, will the online programs be available for people outside of New South Wales? And if not, are there other contact numbers that they can use?
Unfortunately, no. These programs are funded by the Ministry of Health for New South Wales, so they're not going to be available outside of New South Wales. However, if you ring your local health Ministry of Health, like Queensland Health or Victoria Health or West Australian Health, they all have different programs such as staying active in West Australia or staying on your feet up in Queensland, and they've got some really great resources. So I would just either contact your local health department or local hospital, and they can direct you to whatever's available in those states. There is quite a lot of information out there in every state. We just don't happen to have the same programs available all across Australia, unfortunately.
Okay, yeah, but still accessible to, you know, everybody else. Yeah, the different programs.
Yes, absolutely. Yes, all the things I've mentioned today are all across New South Wales. Every health district has access to all the programs I've mentioned this morning today.
Okay. Next question. This is again a little bit specific. I have a swollen knee, so walking and climbing are painful. I'm also currently taking medication for it. What would be the best exercises for me?
So when we went through the suite of exercises today, there was one that I called the front knee straightening, which was for the quadriceps muscle. That was the one where the person was seated and they lifted up their leg up off the ground with maintaining their thigh on the chair. That is really good for the quads muscle or the quadriceps muscle, which is important to take the pressure off that swollen knee. If you have physiotherapy in the hospital or in a private practice, it is a very common exercise that we give to people who have got a swollen, painful knee. If you find lifting your leg so that your leg is straight is painful, then you can lift your leg so your heel is hardly off the ground, so that you're still using that quadriceps muscle, but you're not getting the pain in the knee joint because the leg is fully straight. And then gradually you lift that. So you'd start off with like a centimetre off the ground with your heel, and then gradually you would increase it till your leg is fully straight, maybe over a couple of months. But that quadriceps muscle is extremely important for those sorts of knees, because unfortunately there's a mechanism where the more swollen your knee is, the more it actually turns off the quadriceps muscle. So you need to actually actively restart that muscle by doing that exercise, or your knee will become more swollen and more painful because it will not have the strength and the support from the quadriceps muscle.
That sounds like a little bit of a cycle that needs to be broken there to make it a bit stronger.
Absolutely, and it will not become stronger by taking medication. It will not become stronger by resting. It'll only come stronger by exercising and specifically using that quadriceps muscle. And I'll go back to that little saying, use it or lose it. If you don't use that muscle, it, as I say, becomes weaker and weaker. Yeah.
Okay. So another question, actually there's two questions that I might just put into one. Someone has asked, when can I add weights to my workout? And the other question was, what is a leg weight? So I guess they're a bit combined.
Yeah, no, that's very good. Okay, so a leg weight is a weight that you would put around your ankle. So you can buy them from places like Kmart, Target, and such, and they're about $6 to $10 for two. And they just strap on around your ankle. They are usually made with a neoprene covering, and they're, as I say, very cheap. You can buy a slightly more expensive one from Rebel, and they have little pockets, and you take the weights out and then you gradually add the weights back as you need to. You can make your own ankle weights by getting like an old stock or a stocking and putting like a bag of rice. I usually recommend that you start with 500 grams, so half a kilo, which you can buy a bag of rice, and then pop it in a stock or a stocking, and put it around your ankle. You don't want it up near your knee, it must be around the ankle. I have had clients over the years use things like cans, and then they wonder why their ankles are bruised. So let's just keep away from the metal. The other thing about it is that you need to start where you can feel that it's working your muscle, that your muscle is being used, but not becoming painful. Sorry, the other part of the question was, when would you use ankle weights? When you can do the exercises with no weights easily, so that it doesn't actually feel like it's any effort at all, then you would start to add ankle weights in. Yeah, that you only use the ankle weights for the strengthening exercises, not for the balance exercises. And just as an aside, I have had many people ask, if I wear an ankle weight walking around my house, will that increase the strength of my legs? And the answer is no. It'll just increase your chances of tripping over the ankle weight.
Okay. So another question that I think this one might be for me. It's someone has asked, can I watch this webinar again? Yes, so you can. We'll be sending an email with a link where it will be uploaded to our website, and you will be able to watch it again. I think Trish had some really great videos of those exercises, so you can go back and watch those again and practice those. And she had some really great phone numbers up as well. So yes, you can definitely watch this again. We'll be sending an email to all attendees.
Can I also add, in the Staying Active and On Your Feet booklet, one of the pages is most of these exercises with a picture and a description as well.
Oh, perfect. Yeah. So I think another great reason why everyone should try and get one of those, definitely. And then I think this might be our last question. Do multifocal glasses contribute to falls?
Yeah, I'm very, very lucky in that I get to go to the Australian New Zealand Falls Conference every 2 years. And so that is an opportunity over a number of days where we get different people who are researching different aspects of falls prevention or falls risk across the world. And it's a wonderful opportunity to know what the latest research is about falls prevention. Unfortunately, it was due to occur in New Zealand in November, not this year. Anyway, so I was looking forward to my little trip to New Zealand, but anyway. But to answer the question, there has been a lot of research about the multifocal for falls prevention, and the research is inconclusive at this point in time. Some of the research is definitely suggesting that people wear single vision lenses to stop falls, because they feel that the multifocals, particularly when you're going, say, downstairs, you can be looking through the incorrect part of your multifocals. So if you've been a long-term multifocal user, they're not saying outright you have to change back to single vision lenses. But if you're new to having multifocals, they do often recommend, particularly with uneven ground, with stairs, with slopes, that you maybe use your single vision lenses when you're doing those at first, and then maybe gradually upgrade to using the multifocals, or only use the multifocals when you're on the flat surfaces. So unfortunately, the answer is inconclusive.
Inconclusive, okay. Well, Trish, thank you so much for answering all those questions. I think that was really great. And yes, thank you so much for your presentation as well. I think all of us learned a lot from those suggestions and exercises. Thank you so much.
No, much appreciated to have the opportunity to meet you all, sort of, and to have this opportunity to share my falls prevention message. Thank you.
Yes, thank you.